Hi everyone. Welcome to the Dynamic Bodywork Academy Chinese Cupping Live webinar. I'll be your host this evening, Chamness. And if you haven't already, if you could log in below here, log in with your Facebook account or create a little username and password to log in, and then follow in the chat window for me. I'll be monitoring it over here on my iPad. So hop on the chat and say hello. Let me know where you're from and let me know where you're watching from this evening. I have 8:29, so we will just give it 2 minutes. I like to go a little minute over the start time just to give people some time to hop onto the broadcast. So just a few more minutes and then we will get this webinar on its way. Good evening, everyone joining us in chat. Hi. Thank you for joining us tonight. Glad to have you with us. Okay, that's 8:30 p.m. I'll just give you one more minute and then we will get the show. I am Sally Chamness and I will be hosting this live cupping webinar this evening. So if you have any questions during the Q&A session later on in this presentation, then please pop your questions into the little chat window there. If you can't see the chat window, it's down here. If you do have any type of ad blocker enabled on your web browser, you may want to turn that off to make sure that the little chat window appears. So if there's anything you want to share with the group this evening or any questions you want answered, please make sure that you pop the questions in that little chat window down here below. All right. See a few people hopping online, so thank you for joining us. Just make sure you say hello in the chat. Let us know where you're from so I can say hello back, and thank you for joining me tonight. All right, so we're at 8:31, so let's get the show on the road. Thank you for joining us this evening. My name is Sally Chamness and I am from the Dynamic Bodywork Academy, and tonight I am presenting to you our live webinar on Chinese cupping. Specifically cupping, but we'll talk about the different methods as we go through the presentation this evening. And the reason that we are doing this little webinar, and we'll continue to do these going forward, is just to introduce people of what are some of our classes involved or what we're actually going to be teaching on the classes. So it's just to introduce you to the topic at hand and allow you to ask any questions before deciding whether or not you want to hop on. And now the next Chinese cupping class that we have scheduled at the moment will be on April 19th, and that will be at our Belper location. But if you stay with us through the presentation this evening, right at the very end, I have a little offer for you. So hang in there with me. Hopefully I won't bore you too much. And if you stay to the end, you'll get the details of that offer. And hopefully if you decide to go ahead and join us, there'll be some little extras in there for you. Okay, so I am just going to start the presentation. Now, we had a few glitches the last time we did this, but I've got it worked out now, so hopefully, fingers crossed, this won't make the screen go blank. Okay, so hopefully what you guys will see on the is a little presentation page that says Dynamic Bodywork Academy, Certificate in Chinese Cupping, live webinar Q&A, Tuesday the 31st of March, which is today, and is 8:30 British Standard Time, which is GMT now that the clocks have gone forward. So let's get going. So tonight we're going to talk about who we are as in Dynamic Bodywork Academy. We're also going to talk about what Chinese cupping actually is and how it works. We'll also talk about when you can use these cupping and a little bit about the effects of cupping itself. Then we'll talk a little bit about research, because a lot of what we want to do now is look at evidence-based practices, look at some of the research that's being done on Chinese cupping, and hopefully that will give you an interest in looking into the research that goes along with cupping, and also other massage modalities as well. It's really important that you stay on top of research, that you know exactly how to understand the research and use that information with your clients when you're using these techniques in practice. Then we'll have a little Q&A session at the end of that. So again, if you have any questions that you want to ask in regards to this course, if you could pop the question in that little chat box that's underneath, then we will be able to get those answered for you. And then lastly, at the end, we'll have a little special offer for you for joining in with the webinar this evening. All right, so let's move on. So who are we? At Bodywork Academy, we launched in January 2014, and it's comprised of myself, Sally Chamness, and my business partner, who's Dr. Gillian Hunter. And we were originally involved in previous, we weren't really happy with the way that it was going, the message that it stood for. So we decided, you know, let's start fresh. Let's really push the message that we want to share with the world out there, which is to provide advanced techniques for qualified massage therapists and evidence-based massage practices, all with the hope that we can help push the industry forward and get it to the masses, share massage to the masses. We run hands-on classes that are available in Edinburgh, up here in Scotland. One of our newest locations is Belper in the Midlands. We have classes we're running in London and Kent, and also coming soon will be Leamington Spa. Excuse for the typo in there, that should be Leamington, not Leamington. Forgive me for my atrocious spelling this evening. I originally trained in massage in the US when I lived with my husband until 2010, and then a few things took place in our lives where we hit a crossroads and had to decide what we wanted to do, and really was based on the toss of a coin whether we came back here to Scotland or we returned to my husband's home in Texas and Scotland. After I successfully completed massage school and took both of the certification exams in the US, I hopped on a plane and came back to Scotland, where I opened up my own massage clinic in central Scotland, right in the central belt. And I have been running that successful for years now. There are currently 3 therapists who work there full time, and we're in the process of recruiting for a few more, with the hopes to expand into larger premises in the next few months. I've been lucky enough to make some great friends in the massage industry all over the world, and I like to ensure that I continue my education. Attending courses put on by these fantastic experts, but also by traveling and taking professional development myself, which I hope to be able to use and share with you guys going forward as we develop new courses. But tonight you're really interested in our Chinese cupping course and the certificate in Chinese cupping course. And hopefully you may have heard a little bit about Chinese cupping already, but if not, let me share with you a little bit of the history. So basically, people who the idea of a cupping therapy believe that the suction cups mobilizes the blood flow to promote the healing of a broad range of medical ailments. Now, that's quite a technical explanation, but really there are a few different beliefs in the way that Chinese cupping therapy actually works. If you are into the more traditional thinking, the Chinese cupping therapy itself dates ancient Egypt, Chinese, Middle Eastern cultures. One of the oldest medical textbooks, it says here, the Evers Papyrus. The ancient Egyptians were using cupping therapy in BC. And at that time, what they would have been using would have been animal horn, or they would have been using cuts of bamboo and sucking, having holes in the bamboo and sucking to create that suction effect. And that's really where the use of this type of therapy began. It's similar to the type of medical uses that we see when we had bloodletting, or we were using leeches, called wet cupping, which performs a similar function. But really, it is used in a lot of medical settings, particularly in China, the traditional Chinese medicine protocol. Let's see, coming forward, I guess, into the 18th and 19th century, there were research papers on cupping therapy, which was a collaborative effort between the former Soviet Union and China, confirming the clinical efficacy of cupping therapy. And after that, it became an official therapy found in all Chinese hospitals. Another modern example of the techniques used in Chinese cupping would be the equivalent of the modern day breast pump to assist moms with expressing milk for their newborn babies. So the type of cupping that we commonly see, one is dry cup, which is where we use either a glass cup or a silicone cup and apply that to the skin, where a vacuum is created to suck the skin up into the cup. And the other form, which I mentioned with the bloodletting, is the wet cupping, which is a combination of suction and control. If you have ever had a chance to look at any museums that have pieces on massage therapy, and you've seen older traditional Chinese cupping kits, you'll see that they cut a box that has lots of little razors on the top of it. That's called a scarificator. And normally that box would be used to create the punctures in the skin before the cups were applied, which would then allow the vacuum to suck the blood through the skin, as in bloodletting, to remove what they believe would be toxins or any type of poison within the blood itself. During both types of cupping, substance such as alcohol or paper is placed into the cup and set on fire. Now, we tend to use during our class is we use alcohol swabs and a pair of forceps. We light the alcohol swab on fire, then place it into the cup to then burn off the oxygen inside the cup before the cup is placed on the client's skin to create that vacuum. When the fire goes out and the cup is placed upside down, the air inside the cup will cool, and that's the mechanism that creates the vacuum itself, causing the skin to redden as the blood vessels expand. We generally leave the cups on the body for anywhere from 5 to 10 minutes at a time. Although generally they're left in place on the body, there is a form of the cupping method that is massage cupping, where you can very slowly perform massage strokes along larger surface areas of the body. And it's a similar technique to skin rolling, so it has the same effect and the same benefits to skin rolling. So dry cupping is also called hijama, and as you can see here, this is a picture of an alcohol swab on fire being held by forceps, and it's placed inside the cup. It's rotated around the cup 2 or 3 times to burn off the oxygen, and then the cup is placed directly on the client's skin. So when would you use Chinese cupping? Generally, they say the areas of pain and inflammation greatly benefit from dry cupping as it relieves congestion and allows for easier circulation. Now, personally, I feel that Chinese cupping is great as an addition to our existing massage techniques, specifically if you're performing some soft tissue release techniques or pinning and stretching. Cupping is great for applying a cup to an area of tissue or muscle that you want to create an anchor for, and then allowing the rest of your techniques to either perform a stretch or to perform some other type of massage on the rest of the muscle or the rest of the tissue while the cup remains in place. It frees up your hand. If you are used to performing soft tissue release, you'll know that you have one hand that is applying pressure to a specific point on muscle, and then you're using your other hand to move a limb or to move another area of the body to create that stretch, to create that release. Well, by placing the cup where you would normally place your hand to create that anchor, it's freeing up so you have both hands to be able to perform the maneuver. Now, the image that I've left here for you gives an example of the different strengths that you can use in cupping and how it would impact the different layers of the skin. So we see here that if you apply a weak cupping is generally used for things like bronchial issues. So if you were to apply a weak cup, it would only really affect the top layers of the skin itself. If you are looking at the more traditional ideas, weak cupping is employed where there is qi and yu, and they're stagnant, but the underlying constitution of the client is one of what they say is deficiency or weakness. So light cupping, because it is so weak on the skin, it can be left there for longer, and sometimes light cupping can be left on the skin for up to 20 minutes at a time. Now, the medium cupping that you see, they say that this has a more tonifying effect on the client. Generally, the flame that you use to create the vacuum is held inside the cup longer, so that when you place the cup on it, it sucks a few more layers of the skin up into the cup itself. This is where you start to see the marks appear on their skin. Lighter cupping or weak cupping doesn't generally leave a long-term mark or effect on the skin, but medium cupping is where you'll start to see what looks like bruising. And in the stronger cup, this is is considered a draining method, and this can often cause a lot darker blemishes on the skin. And this one you have to be very careful that you don't leave it on the skin for too long, because as you can see, it will suck up a lot more of the skin and the underlying tissue into the cup, and if not performed properly, can leave negative effects with the client itself. So let's talk about those marks. Here's a great image of a swimmer who received some cupping treatments. If you have a look on that left shoulder, you see that nice solid purple bruise that appears. Now, although it looks like a bruise, generally these aren't tender or sore to the touch like most normal bruises would be. The reason they call it a kiss, it's a bit like the same effect of a love bite. These are small blood vessels that may have kind of popped on the surface of the skin, creating this bruising effect. And this has been a really strong cup that's been applied to this top leg. If you have a look further down the back in the center, you see that lighter cup there just below the cross of the swimsuit. I would say that's been a light cup or a weak cup that's been applied and left on there for about 5 to 10 minutes. Whereas directly above, in the middle, I would say that has been a medium cup that has been applied. Now, cupping had a bit of a resurgence in the media in 2008, and the reason that the treatment of cupping itself has become a bit more prevalent and there are more people interested in it is because Gwyneth Paltrow stepped out to an awards ceremony in a backless dress which showed off these kisses, these cupping marks on her back, and it got the world interested. It got everyone talking about what were these marks, what were these bruises on her back, and then in turn allowed her to share her cupping experience with the world, and it a cupping treatment to pick up interest. Other celebrities have been seen out and around and photographed with the same marks, including Jennifer Aniston, Victoria Beckham. So it's not difficult to sit on Google and have a look and find out exactly who is using cupping as a therapy, and that will give you an idea of the type of examples you can share with your clients of people who may have received cupping treatment. So on our cupping course, what we have done is we have actually broken the course down so that we can cover specific conditions that you can use cupping therapy for when you're treating, or include cupping therapy in your treatment protocol for these. And that includes tension headaches. So with tension headaches and cupping therapy, the cupping is going to be applied in the neck and shoulder region. And generally, these obviously tension headaches are caused by a muscle tension and location of in the areas of the neck and back of the head. It's the pain that tends to radiate into the forehead, sometimes gives people the sensation of cold. Those are the type of headaches that we're going to be addressing with cupping therapy when we're looking at doing that. We're going to talk about lower back pain and sciatica and how to use cupping to aid in the relaxation of the muscles to ease up any impingement on the sciatic nerve itself. We are going to look at using cups to address the symptoms or the pain associated with carpal tunnel syndrome. We are going to look at shin splints, and we're also going to look at ITB syndrome, iliotibial band syndrome. Now, the reason we've picked these 5 specific conditions is we wanted to cover different areas of the body and the most common conditions that we see in our clinics that we may use cupping therapy for. So although these are just 5 conditions that we are listing on the course, we will discuss other conditions we can help with, including respiratory conditions and circulatory conditions. So cupping research. Research is the thing at the moment, especially in the massage industry. We all want to ensure that what we are sharing with our clients and the work that we're performing on our clients has some validity to it. So I recommend that before you create any marketing material for cupping, once you've completed your course and received your certificate, that you do the research required to make sure that you're sharing the correct information with your clients. And here's just some information from a few articles and the addresses of those articles for you to review later on. Now, this cupping presentation page will be available on the Dynamic Bodywork Academy website at www.dynamicbodywork.co.uk under the student area and resources. And if you have attended any of our previous webinars or want to go back and review any of our previous webinars, the information will also be there. So the main research article I want is this one on Biomed Central, and was involving cupping massage on chronic non-specific neck pain. So what that means is people who have had long-term neck pain, which is just a general neck pain, there's no specific reason for it or no specific area of concern. And what they found in this research was that cupping massage improved pain and increased the subjective well-being in the chronic neck pain patients. The increase in pressure pain threshold is consistent with a reduced peripheral sensitization of deeper tissues and findings on dry cupping in chronic neck pain. Now that's a lot of words, but basically that suggests that the application of dry cupping on those who are experiencing chronic neck pain has allowed them to experience a reduction in pain and has reduced any peripheral sensitization, so reduced any sensitization that may have occurred because of the neck pain and any sensitization of the deeper tissues on those clients as well who've participated in that research. So please visit these links that you see here in this presentation and be sure to read the full article. It would take me a few hours if I wanted to go through all the information. But read it, scrutinize it, ask questions, which is the most important part of all. Make sure that you're asking, how does that work? Why does that work? What specifically is it about this technique that I should be taking away from the lesson today? And please, when you attend any of our classes, please make sure if you are uncertain or are unsure of what is going on, or you're not quite sure that you believe in what we're sharing, let us ask us if we can explain it another way. Ask us to provide you with the research that would back up any of the information that we share with you, and hold us accountable to make sure that we're sharing the most legitimate information with you. So more research. Here's a link. Now you'll see that these are both on the same website. This is a great website which, if you put any search term in relation to the massage industry in here, it has a list and lists of articles relating to almost any modality that you could ask for. And these two are in relation to the effectiveness of cupping massage compared to progressive muscle relaxation in patients with chronic neck pain. Another research article on neck pain, how cupping massage to another modality. So it's good to have a comparison to see the difference this particular technique makes compared to something else. And then, of course, the question we all ask, is cupping an effective treatment? And then an overview of systematic reviews. So what this particular article is doing is actually having a look at different articles or different research papers on cupping, and they are reviewing each of those articles or those research papers, and they're coming up with an overview and basically an opinion on research papers to whether or not whether the answer is yes or no would be up to those who are reading those papers. Everybody's allowed to interpret the research papers in their own way, but please make sure that you understand what you're reading in those research papers. And if you don't, reach out and ask someone who does. Reach out and ask for some help, for advice. There are plenty of them on Facebook groups on Facebook where you can ask about information in research papers, and there are lots of very well-educated people in the massage industry who can help guide you to the answer that you're looking for. So this is the Q&A session, and we did have a few questions submitted earlier that I would like to pull up and see if I haven't already answered. And if not, then let's see if we can get some answers for you tonight. Okay, so when I asked people out there to submit any questions that they may have, let's see what they said. So, what are the red marks that it leaves? The red marks, as we kind of touched on earlier, they tend to be referred to as the kiss, and generally it's similar to bruising. It's created by the blood vessels in the body coming to the surface. They are generally not painful to the touch. It's not sore like a bruise. They will heal like a bruise, so you will find that they will turn slight yellow color as the body starts to heal, but it's the same. Sorry, I got lost there a little bit. It's because the fine capillaries under the skin are breaking, basically, which can cause small amount of blood to be drawn up to the surface of the skin, which is where the bruising comes from. Now, we want this to remain under the skin. We don't want to see any blisters or anything appear on the surface of the skin. If that is the case, cupping has been performed incorrectly. So once you are taking a cupping course, we'll show you to prevent that by proper cupping techniques. How long do the red marks last? That is depending on the individual that you're treating. There is a belief the darker the marks on specific areas of the body, suggests that those areas are where you should be focusing your treatment on. Then lighter marks are areas where you don't require as much treatment, or you don't require as much attention. But generally, again, they will last as long as bruises normally last on your body. It could be 24 hours, it could be 3 to 5 days, it could be longer. What we tend to suggest is, as a massage therapist, if you're using cupping technique, once you've finished with the cups and you've removed the cups safely from your client, is to perform a little gently over the top of the areas where you have cupped, and that will help dissipate any of that buildup of fluid to the surface of the skin there, and that can often help with the healing process of those bruises and allow those bruises to fade in time. There are the different shades, and as I said before, generally they suggest that the different colors of the bruising highlight areas of the body which require further attention. There are charts you can get online which relate to the Chinese medicine ideals behind these actual colors, because there are color gradients that we can use. For example, bright red mark in Chinese medicine would indicate that there is excessive heat in the area and possible inflammation. This would allow you to identify it's an area where you would normally use flash cupping. Now, flash cupping is a form of weak cupping, but it is performed rapidly on the surface of the skin, similar to the cupping that you would perform with your hands over the lungs. So flash cupping is quick, it's light, and it's used to generally break up fluid in the lung area. A deep red bruise would indicate stagnant heat. And generally that in Chinese medicine, they would suggest that that's where you would use the wet cupping. A purple to blue bruise would indicate stagnation with the absence of heat. It's suggesting that wind or qi is stuck in that particular area of the body and is unable to move. They would suggest to use cupping, and healing therapy can be used to help disperse the area. A dark black indicates a chronic buildup of sometimes considered toxins. The blood in the area in Chinese medicine would suggest that it's toxic, but that would, to me, suggest that it's been a very strong cup that's been applied and has been left on for a longer period of time. A pale whitish mark, which suggests that the area is lacking in circulation, and there may be some type of blockage in that area. Generally, they don't recommend cupping in that instance. You would use heat compresses or a heating balm to try and encourage circulation to that area. So that's a quick rundown of the Chinese medicine charts used to identify conditions based on the color of the marks left during a Chinese cupping session. What other cultures traditionally do cupping? That's an interesting one, because although we focus on the traditional Chinese medicine cupping therapy, it's also used, or has also been used, by the Egyptians. It's also used by Indians. Basically, any Eastern medicine, an Eastern form of medicine would use cupping therapy, not necessarily Chinese cupping, wouldn't necessarily be glass. As I said, it could be horn, it could be bamboo, it could be porcelain, depending on what's available in the area. In China, who may do cupping? Generally, it's normally people trained in the traditional Chinese medicine doctors or acupuncturists who would be performing Chinese cupping. Now, because it is part of the Chinese medicine field, you'll find that cupping is used generally in most, if not all, hospitals in China. What is behind cupping, and is there proof of efficacy? That is up for debate. Generally, if you are looking for proof of the efficacy of a treatment or a treatment protocol, I would recommend looking into the research, having a look at some of the links I did earlier, have a look at the Massage Therapy Foundation and their research archives. The Journal of Massage Work also contains a lot of information in regards to research on different massage techniques and modalities. It really is up to us to identify whether or not we believe in the efficacy of a specific treatment or protocol. And if all else fails, it's easy to ask some of your industry experts out there at work. Can you explain to me what the benefits are of these particular techniques are? And from my own opinion, as I said before, I prefer to use Chinese cupping as a tool, as part of my massage treatment, not necessarily as a treatment on its own, but I will use it to free up my hands to perform other massage techniques by using the cups to pin a particular point on the muscle or particular point on the body to allow me to perform stretches or movement, or I do perform some of the cupping massage, which, as I said earlier, is similar to skin rolling. So if I find an area where I would want to perform some skin rolling techniques and I find it difficult to get a grip of that with my hands or with my fingers, then I may use a cup instead. Okay, any other questions? If anybody would like to submit a question real quick, can you pop it here in the chat window just below me here? No. All right. Okay, so hopefully that's given you a little bit of an introduction into Chinese cupping and giving you an idea of some of the things we're going to be talking about on our next Chinese cupping course, which, as I said earlier, is going to take place at our Belper location, which is in the Midlands. It's going to be on April 19th. All right. And if you would like to join us on that course for the next 48 hours, if you sign up for the course using the discount code webinar at the checkout, you'll save £30 on this particular course. That'll mean you only pay £100 for our certificate in Chinese cupping course. And that's just for sitting painstakingly through this webinar with me and listening to me mutter on for you and try my best to explain some of the details of the Chinese cupping course. So to repay you for taking the time out of your evening, use this discount code webinar here when you check out on our website, and that will save you £30 on our course. But that's not all. If you don't want to come along to the course on your own, why not refer a few friends? If you refer 2 friends to sign up for the April 19th Chinese cupping course, make sure they tell us that you referred them to us and that you were the one that encouraged them to sign up for the course. So if you get 2 friends to sign up to take part in the course, we are going to give you a free Chinese cupping starter kit worth £50. Again, there's my horrible spelling and typing. I was trying to get this presentation together for you guys this evening, and obviously I didn't do my spell check as well as I thought I did. So yes, refer 2 friends to the April 19th Chinese cupping course and you'll receive a free Chinese cupping starter kit. Now, what does that kit contain? It contains 6 cups, 6 glass Chinese cups. You will get 2 cups per size. There are 3 different sizes. There are smaller ones, which are good for areas like the ankles, some smaller areas around the neck. If you're brave enough, some of the facial cupping, those small cups are great for that. Then we have a medium cup, which is good for areas such as the arms. And then we have the larger cups, which are great for larger muscle areas such as the back, the glutes, the backs of the legs. As well as those 6 cups, you'll also receive a few boxes of the alcohol swabs that we use, as well as your own set of forceps. So you'll get everything you need to start your cupping practice, all for referring 2 friends to us. So I definitely think that's a great offer. So first, if you sign up using this webinar code, you've got 48 hours to do that. By using this webinar code, you'll get £30 off your course fees. And not only that, if you refer 2 friends to do the same, you're going to get your Chinese cupping starter kit for free. All right. So if you want to know more about Dynamic Bodywork Academy, the Chinese cupping course, or any other courses that we may have on offer, you can visit our website, which is www.dynamicbodywork.co.uk. Or you can join us on Facebook. So if you go to facebook.com/dynamicbodywork. And then you can join us on Twitter. Our Twitter name's a little bit different. It's dynamicbw. Or we're also on Pinterest, which is pinterest.com/dynamicbodywork. All right. Also, because it's the 31st of March, I just wanted to remind you that today is the last day for you to sign up for our USA trip and receive the 4 months free coaching as part of that trip bonus. We will be taking that bonus off the cards tomorrow. So if you want to receive 4 months free coaching from Jillian and myself, once you come back from America after visiting the World Massage Festival with us, make sure that you get in touch with us before midnight tonight and we can provide you with more details on getting for that course. So we will be calling it a night on that. If you do have any additional questions in regards to the Chinese cupping course that you'd like me to answer offline, then you can email me, sally@dynamicbodywork.co.uk. All right, so there you go, guys. How painful was that? Hopefully not too bad, yeah? Oh, well, thank you for taking the time out this evening to join me on this webinar. Again, as I said, if you have any questions and you want to contact me directly, you can email me, sally@dynamicbodywork.co.uk. Once this is wrapped up, I will package this webinar up for you and send out the replay information. So for those who may have missed it, they will get that email this evening with the webinar replay and a link to the presentation. It will also be available on our website under the student resources area. Have a look on there, and any of our previous webinars will also be linked there too for you to catch up on if you missed them. Don't forget the webinar code that will give you £30 off of the Chinese cupping course coming up in April will expire in 48 hours, so it will expire on April 2nd. So just make sure that if you do want to hop on this course, that you get in touch in the next 2 days so you can take advantage of that £30 discount. All right. So thank you again for taking the time out this evening to join me on this webinar. I hope you enjoyed it and I didn't bore you too much. And I hope to see you on our next one. Night.